What would you say is the worst skincare mistake that your patients make?
The worst mistake is picking.
Remember, not the way I do. It's getting late September, and I still think about you.
Hi, I'm Amanda McCants.
And I'm Dr. Dan Belkin.
Welcome to Sensitive Conversations with Cetaphil.
Today we're going to be talking about poor decisions, P-O-R-E, which includes bad outfits, bad mistakes, and bad skincare choices.
I've had a lot of all of those. What would you say is the worst beauty trend you've ever done?
The one that I can think of right now is that when I was in 10th grade, I had this haircut with like those little tiny bangs. It was like a wet hair with like little tiny bangs. So I did that for my high school photo. And I had a unibrow and I had like a wet hair with little bangs. It still haunts me.
Can I say something?
Yeah.
That is very trendy.
Well, that's the thing. You know, the problem is like, or I don't know if it's a problem, but like you and I don't know how old you are, but you know, the 2000s are kind of back. The 90s are back.
Yeah.
So like wide leg jeans and, you know, all that stuff is now back. So it's like all those like fashion mistakes we made are now cool again.
Back from 20 years ago.
Exactly.
I would say the worst beauty trend I did was in high school. It was all about a heavy foundation base and mascara. No eyebrows, no bronzer, no blush.
Okay, but now no eyebrows is back.
Not
Right.
on me. I need all the coverage.
No,
I
I don't
get on
like
my
it on
face.
really on anyone. Do you like when people bleach their eyebrows?
I've seen some girls that look really good with it.
No,
There's some really trendy girls right now that look good with a bleached skinny brow.
I know it's really trendy and I saw it at the Oscars. Tell me about some fashion mistakes you've made.
I've made a lot.
Okay.
I'll just start off with I loved every graphic tee,
Yeah.
specifically a hot pink V-neck zebra shirt with
Okay.
a large lime green kiss stain on it,
Okay.
skinny jeans, and Vans to boot.
Okay. I mean, none of that sounds that bad.
Well, we have a picture.
Okay.
I just screenshotted it, so I have it able and ready. But yeah, I think for me, it was just, I loved tight clothing. And
Me
now,
too.
yeah, like now I'm like, I don't need to show
Me
everything.
too. Like I bought all my short shirts way too tight.
Okay.
And then when my metabolism slowed down, you know, when I was like 30, I was like, wow, I can't do this anymore.
Would you say that was your fashion mistake you made?
Probably.
Everything was too tight?
Yeah.
Yeah, you just get older and you're like, I like it loose.
Yeah. I want oversized everything.
Do you guys ever have casual Fridays at the derm office?
No, but I guess we could.
Totally.
Yeah.
Do you think you're high?
I wear scrubs every day. It's really easy. So where do you go to your derm? Do you have a derm?
I don't have a specific derm because I'm such a last minute person.
Yeah.
But I went through a crazy skin moment and I would just call every derm and see who would listen to me.
Okay. Do you want to tell us what it was?
Yeah, I actually want to get your opinion.
Okay.
Okay, so one day, okay, I was sick for like a week
Okay.
or something like that. I don't really remember. And then one day I wake up and there's a rash forming on my face and I get like 100 pimples. I can't even show the picture because like I can't have that live on the internet. Like I'm a very open person, but like, honey, I have boundaries. Okay. And I wake up and I have like 100 pimples on my face and my chest and it comes on in like 4 hours.
Okay.
I go to the derm, the first derm that picks up and can see me. They go, oh, you have folliculitis.
Okay.
It's bacterial folliculitis. Okay, so I'm taking antibiotics. It doesn't really go away. They go, okay, you have fungal folliculitis. Okay, well, I do all the stuff. All the antifungal does is make me bloated. Okay, so now I have pimples and I'm bloated. That sucks.
Yeah.
And then I post on my Instagram
Were you
story.
taking anything? I mean, like, were you on anything before this started? Were you on any medicines or anything?
Nothing other than birth control.
Okay.
I wasn't on my antidepressants yet.
Okay.
I wasn't as mentally stable as I am now.
So you were like bloated, pimply,
Yeah.
depressed.
Anything else you want to say you noticed? Yeah. And I was like, okay. And obviously I'm in front of the camera.
Right.
Yeah. So I post on my Instagram story and I'm like, hey, does anyone know of a dermatologist? And my friend's like, yeah, my mom's a dermatologist in Colombia. She can help you out. Saved my life.
That's so weird.
And you know what else she recommended? I'm not just saying this because I'm paid. She goes, get some Cetaphil face wash. Use something really sensitive.
Yeah.
Then use this. And those are the only things I use. I still get the autoimmune on my face. I'll have a flare up like once a year. What do you use on your skin?
I use Cetaphil face wash also.
Of course.
I recommend that to everybody. I use that, but I also get sent a lot of stuff to try.
Are you ever nervous to try stuff because of a skin reaction?
I'm not that. I have a little rosacea, but I never really get. Other than that, I'm not that sensitive, so I don't get allergies to things. I don't get super irritated from things. So I have.
I wonder what that's like. That's amazing.
I have to try a lot of different things, because I like brands ask me to try them, or I'm on the like some committees where I have to recommend things, so I have to try a lot of stuff.
What are most people asking for right now when they come into the office? What names are you hearing? What faces are you hearing that are very trendy right now?
There's a really popular skin tightening device now called SoftWave. Have you heard of that? SoftWave. Kim Kardashian just posted about it. So that's picking up that's super trendy right now.
You know what? I did see a post about that, how a lot of the people on the Oscars red carpet, all their faces were tight and not in a facelifting way.
I think that starting about maybe the Oscars, maybe it was 2 years ago, everyone looked really tight, and the rumor was that maybe it was from SoftWave, which is this new ultrasound, relatively new, 5 years old ultrasound tightening device that kind of just firms the skin up everywhere.
Okay.
And it's subtle. I think people sometimes have overly high expectations for skin tightening. It's a really hard thing to do. It's sort of like the holy grail of cosmetic dermatology, to get tightening without surgery, just with a device, especially a non-invasive device that leaves no downtime. I mean, that's a really hard thing to do, but SoftWave is probably the best thing we have for kind of firming everything up.
And what's the price range for that?
Probably, so in New York, everything's a little more expensive.
Yeah.
But probably in the country, I'd say anywhere from $2,000 to $5,000.
For one treatment?
Yeah.
And how many do you need?
I think you get benefit from one, but it's the more the merrier. I mean, so you might want to do a few.
And this is where the saying comes in, you're not ugly, you're just poor. Right?
Yes.
All right. Well, I'll start saving up for my SoftWave. Would you do SoftWave?
Oh yeah, I've done it.
Oh,
yeah.
You have?
Yeah.
Well, your skin looks really good and tight.
Thank you.
Oh my God.
Yeah.
This is so cool. I love my family, but we don't have a doctor in the family.
Okay.
Yeah. And I've always wanted to just have a doctor that I could ask questions to.
Yeah. Well, I did my training at USC, and you live in LA.
Okay.
So I know so many derms there. So I'll connect you to somebody.
I would love that. Yeah. Because
Yeah.
I think my problem is that I'm a little last minute. And, when you have a reaction like I do, you need them.
Definitely the reaction that you do. But yeah, it can be hard to make a last minute appointment sometimes, if somebody's in demand. But, you just develop a relationship. You're charming.
So that's how I've gotten actually through life.
Mm-hmm.
By being charming and having people go, you know what? She's not that bad and I like her around.
Right.
That's how I've actually gone through life. And I know that as soon as I get to know my doctor, he hears a couple of my jokes. He'll go, you know what? Bring her in last minute.
Yeah, he'll give you his cell phone and you can text. And
yeah. And do you think if the patient is famous, that helps get a last minute appointment?
I do.
So you think if I do a couple more things, I'll be fine?
Yeah.
Okay.
I mean, you're in pretty good shape already.
Thank you so much. Thank you. Okay, so you went to residence at USC.
I went to residency at USC, my dermatology residency.
I don't even know how to phrase that because I told Dr. Belkin I'm not that familiar with school.
I can tell you all about school.
Okay. What do you do for fun when you're at residency at USC?
We used to come down to these conferences. We're at AAD right now, everybody. And AAD is the American Academy of Dermatology. It's kind of like dermatology spring break. And we used to come down here and just go wild.
So derms drink.
I mean,
But you guys always tell us not to drink.
like I'm sort of over drinking.
Yeah.
Like I think that's another sort of trend is like
agree.
we're all realizing that alcohol is poison and it makes your skin look worse and it makes your whole body worse.
Mm-hmm. There were a lot of derms at the bar last night. I saw them at my hotel.
Well, this conference is still like, people do go a little wild here.
Yeah.
Yeah.
Margaritas at the Ritz-Carlton.
Right.
Not good for the skin.
No. So much sugar, which is
Yeah.
not good for the skin.
You know what I've started doing? If I do drink now, I try not to drink. My favorite thing to do is drink alone. I really do love to drink alone, but I've stopped doing that, like drinking wine by myself. And when I go out socially and have a drink, it's tequila on the rocks.
Right. Yeah, I like that too.
Yeah. Like that's good. And I
Right.
think it has an air of sophistication with it.
Mm-hmm. Are there any skincare trends that you've tried that you liked or didn't like?
Yeah, I saw this YouTuber post that I should stop washing my face and just use like facial wipes.
Yeah.
And so I didn't wash my face for about a year.
Okay.
And I just used facial wipes. And every time I would go to get a facial, they'd be like, there's like a lot in your pores. Like, what are you using to wash your face? And I was like, I'm not. And that was not good. Because I do a lot of tanning too.
Right. What?
Well, fake tanning on my
tannings,
face.
that's
So it
fine.
would like be in my pores.
Yeah,
'cause I
and it
never
would just
washed
like
it out.
layer on itself. Like layers of paint.
Yeah.
that
It
were
was
chipping
not
away.
good.
I feel like I wash my hair too much.
Once a day?
Yeah.
Me too.
And sometimes twice. Like if I shower in the morning and then I have stuff in my hair and then at night I can't sleep if I have like any like oil or anything in my hair. But it's bad because I have gray, wiry hair, so it's like it gets so puffy. But I want to start washing my hair less.
It's a clean thing though. And I feel
Yeah.
like if I don't wash my hair at least once a day, my face looks bad.
What? Because the oil of the hair can,
Correct.
yeah, definitely you can break out. But like it's not great. It's good for your scalp to wash, but it's not so good for your hair strands to wash them every day. They get dry and frizzy.
Well, we were having an issue with my hair during the podcast about how it was frizzing, so maybe that's why.
That
'Cause I'm
didn't
washing it
inspire
too
me.
much.
Don't worry. I was thinking
Don't
about
say me to my face.
no, I was thinking about my own insecurity about my own hair.
I think you have great hair.
Thank you.
And you've got like a full head of hair.
That's true. But it's like almost all gray.
Yeah, but that's cool.
Yeah, no, I own it.
Okay, good.
But I'm just thinking about like, skincare trends that I want to potentially pursue.
Okay.
Yeah.
Do you feel like gross when you come home from the office, like touching everyone, seeing everything?
I don't do anything that gross for the most part.
Because your clients are rich.
Well, yeah, and I do a lot of cosmetic. Like I'm a little bit more cosmetic and surgical, and I mean, yeah, if a cyst explodes on me or something, then I feel disgusting.
Oh my God, I can't. Like,
But that usually doesn't happen.
I would be the patient that.
Where you had
My
your
cyst
cyst
would probably
explode. Yeah, it's embarrassing when your cyst explodes. Right?
It sucks.
Yeah.
That's not sexy.
Yeah.
Yeah, then you'd have
Yeah.
to shower.
Right. I once had a guy who was like so insecure about this huge cyst, and he was going on vacation to Mexico or something where his shirt was going to be off, and like we, tried to open the cyst and it splattered all over the wall, and he was mortified.
I would be worried
Yeah.
if he wasn't.
Right.
What would you say is the worst skincare mistake that your patients make?
The worst mistake is picking. Too many people. I mean, we all pick. It's just like it's human nature, but you can make things so much worse. And I have to tell so many people, like, stop picking. Also, another thing is like fixating on one little tiny thing, like one little tiny wrinkle, one little millium, like, because people, everything looks bigger to you than it does to anybody else. Nobody's thinking about you that hard. You're thinking about yourself way more than anybody else, right? Like you care about how you look right now. You don't care how I look right now.
I do care how you look. I'm looking at you.
I know,
I don't
but
want to look at someone who doesn't look good.
okay.
You look great. And your skin looks good too.
Thank you.
I know what
You
you're
do
saying.
too, but I'm not
I know what
like
you're saying.
I'm not scrutinizing you. Like to me, you look hot and great.
You too.
Thank you.
Yeah.
But I'm not, I'm not like, I'm only noticing those little tiny spots when you show them to me. I'm not thinking about them.
100%.
I'm looking at you like as a whole 3-dimensional person.
Mm-hmm.
But I think we all fixate on our own little flaws and nobody else is thinking about them. So and if you start to chase them, you can make things worse. You know, having to do these sort of procedures on yourself to make you look or feel younger. You know, a lot of what I'm doing is like, yeah, I see the line that you're talking about, or I see that little spot that you're talking about, but like, that's not that important. Let's do something that's like more globally beneficial, or, you know, not chase one little tiny flaw, you know?
You're like a therapist almost.
Kind of.
Yeah.
Are you a picker?
So I
Yeah.
don't know if I'm a picker, but I love to extract things on my nose. And it's definitely made things worse.
Okay.
And it's definitely made the skin on my nose a little bit porous. But oh my God, like when you get something good out.
You mean like your
The blackheads on my nose.
black? Okay.
I love a pore strip.
I like getting, you know, stuff out from my nose too. I mean,
You do it too?
Of course. I mean, you know, like if you have any, they're called sebaceous filaments, actually.
Of course. Yes.
Yes. And if you have, you know, but the thing about pores is that everybody has pores. And do you ever see on Instagram how they'll show like people's real skin texture? You know, because a lot of what you're seeing online is filtered and face-tuned. And so like you think people look around and think that everyone has this like poreless, flawless skin, and they don't.
Have you seen my mom's skin?
Your mom has flawless skin.
She's here.
Yeah.
And she has flawless skin.
She does. She does.
So everyone but her.
Right. Right. Most people don't.
Totally.
And everybody has pores except for your mom.
Yes.
And you know, pores are normal. And yes, there are things we can do to sort of minimize the appearance of pores, but you can't have poreless skin. I mean, it's just, you need your pores.
Right.
So I'm going to ask you what's hot or not because you're cooler and hotter.
Okay, thank you. But I don't believe that.
I do.
Just go ahead. Thank you.
Low-rise jeans.
Depends if I got a detox massage the day before or not.
Okay. Do you like when you can see butt crack?
No!
That's terrible.
I'm a classy woman.
I mean, when you say low-rise jeans, like, are you talking about butt cleavage or no?
I'm not talking about butt cleavage. I'm just talking about a low-rise jean below the hip, maybe.
Okay.
I think a low-rise jean not hot on me.
Okay.
Not hot on me.
Yeah. Okay. Bangs.
Oh my God, I just got fake clip and bangs the other day. They were so good.
I hate bangs.
On you or in general?
In general.
Guys don't love bangs.
I know.
No, they don't like bangs.
Yeah.
Yeah.
I feel like it really never feels like the right decision.
I understand. I understand what you're saying.
I guess there are some people where it fits their face, but I don't know. I haven't really seen great bangs.
Right. Do any of your
have?
clients have bangs?
Not many.
Okay. So all the rich, hot women don't have bangs right now.
No. Why do you think that might be?
It's just not. Yeah. I don't think bangs are a universal great look.
Right. It's kind of edgy, but you're not trying to be like attractive.
Right. Like edgy and I don't need anyone to think I'm hot.
Right.
Yeah. I understand.
Okay. So what did we decide? So not? Or you like a bang?
I don't know. I feel like a lot of these are really difficult if I'm being honest.
It depends on the person.
You know what? How about I say this?
Yeah.
I think it's cool if you're not trying to be conventionally hot.
Me too.
Like, that's awesome. So I'm actually going to say bangs are hot because it means you don't really care.
Right.
And that's awesome, right? How liberating.
So it's hot because it's not hot.
Correct.
Okay. Almond milk.
Hot.
Agree. I don't
Hot.
even know why that's on there.
Yeah. Well, who's saying not?
Yeah. Are you like almond versus oat?
No, I'm just almond.
Of course. Always almond.
Yeah, always, because it's less caloric.
And like, who drinks cow's milk anymore?
Apparently, dairy's good for your gut bacteria.
It's not good for your skin.
I know.
You've
Okay,
experienced- okay.
almond milk's hot.
Okay. 10-step skincare routines.
Not hot.
No.
Right? Not hot. I hate overconsumption.
Yeah.
I hate that.
Right. And it's just a waste of time.
Correct.
Like, I feel like we all have things to do that are more important.
Hang out with your dog.
Yeah.
Yeah, you don't need that extra
Yeah.
moisturizer.
Like, life is short.
Yeah, totally. And that's coming from Dr. Belkin.
Right.
So I have something to ask you.
Yeah.
And it's something kind of that plagues my mind sometimes.
Okay.
What is the perfect outfit to wear to your dermatologist appointment?
It depends what you're doing.
Okay, it's not if you need to extract a cyst. It's if you're coming for a routine checkup.
If you're coming for like a skin check, then wear sweats.
You're not judging if we come in sweats.
No, don't wear makeup. Don't, like, ideally you don't even have like nails on. I mean, so if you're coming for a skin check, you want your derm to look you head to toe. So you want them to look at your nails because you can get skin cancers in the nails. You want them to look at your scalp, so you don't want to have like too many extensions or, you know. Do you feel seen?
I can't come in.
You don't want to have it like in a tight style where you're going to have to undo it. You know, you don't want to have something that's like hard to take off. You want to just wear sweats and you're going to be stripping down into your underwear.
Are you finding more skin cancer in the nails with all of the gels and everything going on right now? Is that a concern for you?
No, I don't think so. I mean, the gels can increase your risk of infection in the nail.
Yeah, I've had that.
And sometimes it can, you know, when you see like in your nail, like little white patches, that can be from the gel too.
Okay.
But skin cancer, I don't think we've seen an increase in nails from that stuff. Are you looking at your mom?
Yeah, she always tells me I shouldn't do gel for skin cancer.
Well, if you put your hand under the UV light, you know, that's increasing your risk.
It's LED light now. It's not UV light.
Oh, then you're fine.
Then I'm fine.
Yeah.
But can I ask you something else? My nails are allergic to the gel.
Then don't use it.
Okay.
And then if you're coming in for injections, like, you know.
Best day of the year.
Then I would wear something that, like a tank top or something like that, like in case you have to have numbing cream, because I hate when people, you know, when we put numbing cream on your face or your neck, you don't want it to get all over your like nice clothes. But definitely don't come in with a full face of makeup. I mean, people do that all the time, especially in New York, because like when you go out in New York, you can run into people because, you know, everyone's on the street. So I think people don't like to like come looking schlubby. But in LA, they probably could.
Yeah, everyone looks like a schlub all the time.
Yeah.
But a hot schlub. It's like a $500 sweatsuit.
Right.
And laminated brows, but you still don't have makeup on.
Yeah.
Okay, I feel like after our talk, I've confronted all of my past poor decision trauma, and I think I'm ready to move forward.
All your trauma, even that folliculitis?
No, not that. And you're not seeing that. You are.
Okay, that will traumatize you.
It'll
forever.
probably traumatize you too. Sorry.
I don't think it'll traumatize me. Should we finish with some final skincare advice?
Yes, absolutely.
I guess my final word would be don't obsess about things. That's it.
Okay.
I think you get into trouble when you obsess about small things.
Right. That's actually really good advice.
Yeah.
Mine would be just be hot and use Cetaphil.
If you want to find me, I'm on Instagram at Dr. Dan Belkin.
And if you want to find me, I'm on Instagram, Amanda McCants, TikTok, Amanda McCants, and YouTube, Amanda McCants, because I have a family to feed.
Well, thank you so much, Cetaphil, for having us. We had a great time.
And thank you, Dr. Belkin, for all of your knowledge.
Thank you, Amanda.
Bye, guys. Thanks. Thanks, Cetaphil.
Remember, not the way I do. It's getting late September, and I still think about you.